Thank you, Mr. Chairman, and I'll definitely be brief. Thank you very much for your testimony this afternoon. We appreciate very much on this very important issue. Just a couple of your thoughts, your opinions. You were so kind to share so much of important statistics, which is always very relevant, given the committee that we are in right now.
Right.
And your comment that you made that a $1 in prevention, saves us $10 down the line is something that some of us are aware of and some of us may not be. And I thank you for bringing that out in front of our committee today.
Yeah.
A couple of just your thoughts. Given the epidemic that we have in the use of opioids, and knowing very well that a lot needs to be done as far as our state is concerned, and also knowing that there are several bills in the building, addressing that, because obviously we are so concerned about the epidemic. My question, as extending to what the good Senator Boucher was referring to in terms of the taxation, what is mentioned here, do you think that will adequately cover what you have in mind in terms of the programs as far as our state is concerned and as far as the epidemic use of opioids?
I can't give you specific numbers on the costs, and I really will leave that to you to address. I can reemphasize, and I cited that one example of the medication drop box, that for every dollar that you do decide to put in, you will save $10 on the other end as far as addressing negative consequences. So I really will leave that to your committee to identify specific numbers.
Thank you. And my final question to you is that, the various programs that exist in the state, as per the state and federal treatment protocols, could you tell us how many of them exist in the state right now?
Okay, I'm sorry. Could you repeat? I'm quite understanding.
Do we have any programs, that would follow state and federal protocols that are already existing,
right,
who will obviously be the beneficiaries of these grants if this bill were to pass and money were to be collected?
Okay.
How many such programs already exist in our state?
I didn't know the exact number of programs, but I think this bill is looking at sort of a regional perspective on prevention and treatment programs. And I can tell you that every region definitely has treatment programs that address this increasing abuse. Outpatient programs. There are no inpatient programs for opioid abuse or for detox at this particular point, but we have a lot of outpatient. In terms of prevention, again, we look at prevention from a multi-strategy approach, so we do have plans that are in various stages of implementation that will implement different pieces of that. SBIRT is one of them: screening, brief intervention, referral to treatment, early intervention, getting physicians and people in healthcare clinics to start asking questions about prescription abuse. The other one is the education around prescribers. There's lots of different ways that prescribers can get educated, webinars and those types of things. But in all honesty, when we do face-to-face, we have that opportunity like we do here for engagement and the types of questions that prescribers may have. So I think any of the programs that focus on SBIRT, which is evidence-based, and the educating prescribers, and those happen at the local, regional, and state level.
Thank you very much.
You're welcome.